Hello, good afternoon. This is Dr. Do again. This video is on alphabetic list of problem on letter E. Today I'm thinking to talk about endocrine system and diseases. So basically diseases on the endocrine system. Since we're on letter E, endocrine is a system. It's kind of complicated, one of the most complicated systems, and with multiple hormones, organs, and the feedback mechanism to regulate. So the disease is the most common one, we know, diabetes. But in addition to diabetes, there's some other diseases belong to endocrine system. So basically, it's start from any situation. You need to see the emergency. Of course, there's some. First of all, diabetic related emergency situation is either coma caused by the ketoacidosis, or hyperosmolarity caused the coma, or hypoglycemic. You're diabetic, you're in insulin, you suddenly feel lightheaded, might lose consciousness in any minute. So that's the case. Don't hesitate to call somebody to, even though not going to emergency room, or if you're a long-term patient of diabetic, you probably know it is probably episode of hypoglycemic due to your changing medicine dose, or changing exercise level, or changing your diet. So it might cause this episode. If that's the case, you probably have somebody help you right away, either give you some sugar or drink, sugar water, or the juice, just to make it. And even though you drink some sugar fluid, but still visit your physician or go to the emergency room to make sure nothing serious is going on. So this is the emergency situation. Other endocrine emergency, I think, could be the hypothyroidism, the hypothyroid crisis. This usually, it's a kind of, I think, just the one-time burst releasing of thyroid hormones, either from inflammation or from the post-surgery or any other condition, or you have hypothyroidism and then you increase the distress level, can cause the sudden burst releasing of thyroid hormone, can elevate your blood pressure, heart rate is high, and it's kind of crisis. So if that's the case, it's called a hypothyroidism storm. So really kind of serious. So you need to see emergency to treat right away. And other than that, there's some other, of course, there are some other situation you need to visit your physician as soon as possible. If under severe stress and you have the disease of adrenal gland disease, under severe distress, might cause really hypotension, blood pressure drop into shock state. So if that's the case, you also need to see the emergency as soon as possible. So these are the situations that I can think related to the endocrine disease. Anything related to the endocrine organ or diseases you can manage at home? Probably not, because the endocrine organ, they are so important, from the hypothalamus, pituitary, and then going down to thyroid, to the adrenal gland, to pancreas. So these are the, and also to the other organs have the endocrine functions. So these are all the really important organs. So any of these organs have problem, cause the endocrine disease, you need to see your physician, to address by your physician, to treat it. Even though some of them are kind of subtle, for example, the mild form of hypothyroidism, it could be subtle symptom, just feel cold intolerance and lack of energy, lethargic, and also dry skin. But still, you need to treat it, to be treated with the thyroid hormone. Otherwise, these symptoms will only getting worse. So regardless, any of disease occurred in the organs of endocrine system, you have to see your physician, address by your physician, managed by your physician. So let's start from the endocrine What is endocrine? Why it's so important? You also always heard endocrinologist. So these are the subspecialty manage the disease occurring in endocrine organs. So its endocrine organ system has the capacity to secrete the chemicals and through the blood transport to the remote distant organ to function. So this is basically the endocrine definition. So endocrine organ start from brain, hypothalamus, that's the one, and after it's the first level, and after that is the level of second level is pituitary gland and some others, but most important pituitary gland. And then the third level is other organs like the thyroid or the adrenal gland or pancreas. So basically this is the whole picture of endocrine system. So any of these organs had problem that need to be addressed. For example, pituitary gland. The most common problem for the pituitary gland is the adenoma, just a small growth in that gland, or some hypopituitary state. For example, there's a disease called Sheehan's. It's occurred postpartum period of time. Women might have suddenly the pituitary gland failed to function, so cause multiple endocrine organs decrease the function, depress the function of endocrine organs. So the pituitary gland adenoma is really sometimes asymptomatic, really, because it's so subtle and the body has the mechanism to maintain the normal function, normal feedback. As a matter of fact, a lot of time pituitary gland adenoma is presented with a vision problem because the anatomic location, the pituitary gland sitting on top of the chiasm, which is formed by the optic nerve. So during this, so the pituitary gland has a little growth over there, just press this chiasm, so cause the vision problem, lost the peripheral by temporal vision. So if that's the case, you see your eye doctor and find out it's a pituitary gland problem. Hypothalamus, usually the problem for hypothalamus is really from the a brain problem, like ischemic, or so that's probably the major cause for the hypothalamus dysfunction. In terms of the thyroid, there could be many causes, like the thyroid gland enlarged, or hyperthyroidism, hypothyroidism. You probably already heard of that. And also if the thyroid hormone mainly function for thyroid hormone is regulate metabolism. So you have too much thyroid hormone, just craving for the food or the energy resources. You feel like a heartbeat faster, you feel sweating and flushing, and blood pressure elevated. So all of these symptoms indicate you eat a lot. Even though you eat a lot, still feel lose weight and not enough energy, and your heart rate beat really fast. So these are the common symptoms for the hyperthyroidism. In terms of hypothyroidism, I already mentioned, it's quite common in female, especially for middle-aged female. So pancreas, we know, is diabetes. I have several videos about diabetes. I'm not going to talk about that. Adrenal gland, I think I had that adrenal gland problem in the letter A section. So basically, I just gave you the whole picture of the endocrine, the axis. It's called endocrine axis. The 3 levels of organ from hypothalamus, pituitary, and the 3rd level organs is the thyroid, pancreas, adrenal gland, etc. So this is the video kind of introductory, and along with the endocrine system disease, endocrinologist, what kind of condition you need to see the emergency, and what kind of sign, for example, the hypothyroidism, the sign of hyperthyroidism, you need to call your physician. I'm going to stop here. I thank you for watching. I will see you next time.